A non-governmental organization, Thriving Up Initiative, says to address the high rate of deaths during birth, healthcare workers and midwives in rural areas must be trained and retrained to build their capacity. Our trainers said this at the flag-off of Not Another Number campaign, a campaign designed to ensure that another number is not added to newborns dying in Nigeria due to preventable causes. The two-day capacity workshop is organized for healthcare workers in more than 10 communities in Kuje Area Council of the Federal Capital Territory here in Abuja.
Our goal is to ensure that every child is able to live up to their utmost potential by providing the adequate care that they need at that early stage of their life. And so for this workshop, we are here on a two-day workshop to train community health extension workers on how they can, diagnose early issues with a newborn as soon as they are born, so that we are ensuring that they are able to diagnose, manage at their level, or promptly refer. That way, every child gets the care that they deserve, quality healthcare services, and they are empowered to live up to their utmost potential.
Not Another Number campaign, and it's one of our concerted efforts towards ensuring that not another number is added to the number of newborns that we lose every day to preventable causes. And this is what we do as an organization. We're working to end preventable newborn deaths and improve health and development outcomes of babies. And it has become important that we begin to strengthen the health workforce, the community health workers, the midwives, the nurses. These are the hands that deliver neonatal care and maternal care.
What I've just learned now in a newborn baby, that is a baby was just giving birth, within 30 minutes to 60 minutes, I have to be there some things I need to organize. I need to check the baby to know whether the baby is breathing well. Then I have to check the baby, whether the baby color is okay. After the delivering, within 30 to 60 minutes, the best thing I have to check the vital sign, which consists of temperature, respiration, and see the color of the child. After that, I need to check the cord, whether the cord was even or clear, and how to check whether the baby is crying well.
As we started this program, we have learned so much in the last 30 minutes now on how to manage a baby from at birth to 30 and 60 minutes now. And it's going to be profitable to us, because before we never remembered most of these things when we left out school. But now it is beneficial to us because it's helping us a lot.
What you have in the studio, Amarachi Ibe-Kalu. She is the brain behind the initiative with a passion to save lives. Amarachi, good to have you here.
Thank you. Thank you for having me.
This campaign, well done.
Thank you.
Well, let's look at the facts here in Nigeria. 1 in 5 children will not make it to their 5th birthday, only because of certain reasons, especially preventable ones. I like this campaign. You say we have to train, the midwives and nurses in the rural areas, because of course 80% of the death we see happen in the rural areas. Talk to us about, how you intend to get them, equipped with the knowledge they need to help us reduce this number of deaths we're seeing in the country.
So it's one thing to have, access to healthcare, which is the institution, the healthcare centers, right? It's another thing to have access to skilled health workers who are in there to provide skilled healthcare to these mothers, right? So it's important that we start to train them, we start to teach them what are the techniques you need to look out for in newborns, what are the danger signs, because every minute matters once that baby comes out of the womb. That is a very crucial time, and it's the health workers who are in that time to deliver that baby that can mean the difference between life and death. So if they are trained and if the health worker knows what to do in a critical condition or in a case of complications, they can save that baby's life. So they are a very important factor in ending preventable newborn deaths and saving newborn lives. We cannot do without having trained health workers, because they see the danger signs, they have the solutions. If they are equipped with the knowledge, they're equipped with the skills, they have the resources, there's no reason why we should be losing newborns to preventable causes. And the sad part of it is that these deaths are preventable.
Preventable, but at the end of the day, you have been in the field. Let's talk about some of the main causes of deaths in our infants in Nigeria that you, in your line of work, you have noticed, and this caregivers have spoken to you about, and how they could have been prevented in the first place.
Good. One of them is lack of drugs, lack of equipment, and the lack of equipment is like the most important thing. You see nurses having to work with scissors razors that are not sterilized, equipment that are not sterilized. All of those could lead to infection, even in a healthy baby that wouldn't have had any reactions or any, life-threatening cases. But because of those unhygienic items that are being used, they are introducing infections to those babies. And in those health environments where the nurses don't even, especially when they do not have electricity, they are dealing with torchlights. So you have a midwife who is struggling to deliver a baby and also struggling to provide lights in that situation. There is no way that mother will be able to provide, that nurse or health worker or midwife would be able to provide skilled care to that baby. And that's why we lose them. Sometimes babies lack oxygen when they are born. They lack oxygen, that effective flow of oxygen to their brains and to their organs. There are equipments that if nurses have handy, if physicians have handy, they can start to use to save that baby's life or pump air into that baby. And at that point, the midwife is handicapped. She doesn't have the equipment. She may know what to do, but she doesn't have the requisite equipment to, do what she knows how to do. So most times they're just looking and they're helpless. So if we have skilled health workers and we provide them with the right equipment, we would have gone a long way in tackling some of these causes, because it's the drugs, is the skilled health workers, it's the equipment. All of these items come together. It's so many factors coming into play, and we can't address one and leave the other. We can't say, okay, we're providing healthcare centers in underserved communities and we are not equipping them with skilled health workers, or we can't say we have healthcare centers that are functioning and we don't have drugs, we don't have equipment in those healthcare centers. So all of these factors need to be working together to ensure that a baby's life is safe, because once babies transition from the womb to earth, every minute matters.
Absolutely.
It's the question of grabbing the equipment and pumping, air into the mother, which was some of the practicals that were done, yesterday, that were exciting to see. And the question became, but we don't have these things. Now we know what to do. We don't have these things. So it's the places ensuring that the healthcare centers are provided. It's the people ensuring that they are equipped with the skills that they need to save this life. And it's the products, it's the drugs, it's the equipment.
Very critical.
Exactly. So we will lack all of
So are
these.
you limiting your training to the primary healthcare facilities, or you're open to even women who help with birthing at home?
Yes, we're open to women who help with birthing at home as well. Those are traditional birth attendants. Right. They also need to be trained, because there are cases where you can't do without them.
Right.
They are literally the saviors that these women have.
Right. Well, Amarachi, you are not a doctor. Talk to me about the passion that led you here to decide to do this, not for your own children, but for the children of Nigeria.
Right. So it started with my own child.
Yeah.
So it was me trying to provide her with the necessary environment to foster optimal development, because I was going to have a baby. I was quite young. I got married like very early, and I was going to have a baby, and I discovered I didn't know anything about caring for a newborn. In the hospitals, all of the conversations are around safe childbirth. Everybody's talking about safe childbirth. Okay, I'm at my 9th month now. The baby is coming. What do we do next? How do I care for this baby? How do I provide optimal development for her? How do I help her hit her milestones? And I started to research. It was in the course of that research that I realized that the problem was quite big. The gap was huge. It was a gap in providing health services. I realized that Nigeria had a very high infant mortality, and we were losing 57 out of 1,000 newborn deaths.
Well, that has actually dropped from last year.
Yeah.
Now it's about 56 deaths per 1,000.
Per 1,000.
Amarachi, what sort of support would you want from whoever might be watching, be it the government or private individuals? And how do you think we can reduce this infant mortality rate in Nigeria, in your opinion, from all that you've seen out there?
In my opinion,
Two questions
I
quickly.
think is the political will. It's the investment. If we prioritize investments in training health workers, if we prioritize investments in even creating safe working and living conditions for these health workers, if we prioritize budget allocations to a healthy workforce, right? If we don't have a healthy workforce, you can build and build, and there's nobody to actually provide this thing. And we need that intentionality. It's not like we don't have these resources. We just need our leaders to be intentional about making investments in training a skilled health workforce that can deliver maternal and newborn care that saves the lives of these babies. It's the intentionality, really.
Intentionality is what she says we need to see from our leaders. Prioritize healthcare, because at the end of the day, Nigeria has the highest infant and maternal mortality in the world. Shameful, some would say. But Amarachi, people like you will help us, and of course our healthcare workers out there. I have to say thank you so much for all that you do, and of course for joining me tonight on the program.